So today we're going to understand the topic. Right? Our topic is fibroadenoma of the breast. So basically, there are two different pathologies: fibroadenoma and fibrocystic adenoma. Right? They are of different type, and to understand its pathogenesis, we have to understand different hormones and its effect on the body. Right? Then only we can understand what is the exact difference between these two pathologies, because we have to prescribe differently in these two conditions. So to understand this, first we have to understand the estrogen, right? So estrogen basically it is a hormone which is responsible for the ductal growth, right? For the branches of the duct within the breast and the breast development. And you can say all the secondary sexual characters. This is a main hormone which is responsible for that. It is also responsible for the fat distribution. So in regard to shape, size, contour, and this hormone is very important. It increases the vascularity, right? And so there is and particularly during the follicular phases of the menses, right? Menses have two phases, follicular and luteal phase. The first 14 days are the follicular phase, and then the last 14 days are the luteal phase. And this hormone is responsible for increased vascularity, and that is why in that 14 days the person can feel a tenderness in the breast. Other thing which is very important, that is stromal growth. The stroma is a connective tissue, right, which gives support to the structure, and particularly the milk producing glands and ducts, they give support to them, right? Stroma. And whenever there is a fibroadenoma, basically it is due to the excessive growth of the stromal tissue, the connective tissue, along with some part of the glands. So different reasons, for example, pregnancy can lead to the lead to the growth of this hormone, which further responsible for the growth of the breast and to prepare a lady for the lactation, right? It also develop the ductal system. So this is how the estrogen is responsible. Estrogen is very important hormone, and basically estrogen is having a different effect. Basically, it creates a lot of complication in the female patients. Other hormone is progesterone. Right? It is a counterbalance hormone. You can say it is a counterbalance. But basically, it is responsible for the lobules, and alveolar development, right? Which are the milk producing unit. They are responsible for their growth, basically, and it acts as a complement, right, for the primary secretory activities during the pregnancy, which is very important for the lactation. So its effects is post-ovulatory, because after ovulation, right, the progesterone is produced from the corpus luteum, and so this is the hormone for the luteal phase, and it is responsible for fluid retention, right, breast swelling, tenderness, and heaviness. Like the estrogen causes the tenderness by increasing vascularity. So this causing tenderness by increasing the ductal growth, basically. And this is a major role in counterbalance the effect of the estrogen, right? So hence it controls the growth of the breast. So progesterone is the hormone which is responsible to counterbalance the estrogen. It decreases the over proliferation. Otherwise, there is no end to that, and then there is a lot of complication, right? And what happened after the postmenopause, the estrogen and progesterone both goes down in the body, which lead to the atrophy of the glandular tissue, and that is why all the ductal system goes away, and there is only fat in the breast tissue. So these three hormones are very important. Other hormone which is important is prolactin. You all know it is responsible for stimulating the milk production, right? So naturally it acts on the ductal and lobular tissue, and there are so many things, so many conditions in which patient can have hyperprolactemia. The prolactin hormone will be more, like for example stress. In stress, if patient is on the antipsychotic drugs, it increases the progesterone level. Then thyroid imbalance, pituitary tumor. In these conditions, the prolactin is more. If prolactin is more, then the patient can have these issues like discharge from the nipple and and tenderness, pain, inflammatory state, and all the things can affect that patient. Other hormone which is very important is cortisol. We discuss cortisol in very detail when we study diabetes, type 2 diabetes. And as you know, the cortisol is a stress hormone, basically stress hormone. But how cortisol is related with the progesterone? So if you try to understand all the basically hormones like cortisol and estrogen, testosterone, they all are basically derived from the cholesterol. The basic unit is cholesterol. And the cortisol and progesterone, they are related to each other very closely because they are having the same precursor, right? They are having the same precursor. So whenever body needs more cortisol level, right, then naturally it has to use more of that precursor raw material, which lead to less progesterone level. So whenever there is a less progesterone level, then estrogen is having the upper hand in the body, right? Because it is a counter hormone to the estrogen. So whenever progesterone is low in the body, estrogen can cause more proliferation and more development of the different structures, right? Other hormone which is very important is insulin, right? This also we discuss in great detail. Whenever there is insulin resistance, right, it can lead to delay in the ovulation, and whenever the ovulation is delayed, then progesterone, the role of progesterone, it get decreases. The amount of progesterone get decreases because progesterone trigger after ovulation, right? Other thing is insulin growth factor, right? Because it is responsible for the growth and development of the body structure. So if insulin resistance is more, then insulin level are more, then insulin growth factors are more, which lead to more growth and development. Other very important hormone is melatonin, right? This also we discuss in diabetes when we discuss the sleep pattern. That at the night time when we are going to sleep, the melatonin and growth hormone, they increase in concentration, then they fall down at nearly about the 3 a.m. So melatonin basically it is a sleep hormone, but it is having the anti-estrogenic effect. Right? It is the anti-estrogen. So what happens whenever melatonin is low, then estrogen will be the high, and due to high estrogen level create a fibrocystic changes. Then why melatonin in these day-to-day issues, there is a lot of issues having with regard to melatonin. Why? Basically, if you see, if you try to understand your life also, so when you are, suppose you are going to sleep, right? And moment you are going to sleep, you just switch on your, unlock your phone and you start scrolling anything, right? Instagram or anything, or you are just reading notes or something else. You suddenly feel that your mind become active, and the sleep which you are feeling a few minutes back, it just goes away. Why this happen, right? Basically, our retina is very sensitive to the blue spectrum of the light, right? Blue light is very abundant in our nature, and due to the evolutionary experience, we are very sensitive to blue light, and whenever we get stimulated, or we are seeing blue light, basically our eyes is signaling the brain to delay the melatonin, right? And that is why in today world there is a lot of things, right? If you see the specs, you will see the screen as blue basically, right? Because these specs are with a blue filter, so it filters the blue light, right? So this blue light is from the phone screens, TV screens, LEDs, LCDs, and they are affecting a lot of people, and that is why there is a lot of people with insomnia, and they are watching TV, and they said, okay, we are not able to sleep. They are not sleeping because their eyes are giving a regular signal to the brain for not secreting the melatonin, because this is not the time to sleep. They have to work to do, and then this is very, very important. So whenever melatonin goes down, it will lead to the high estrogen level, and this is how it affects the whole system in the body. So in this way, different hormones like from estrogen to progesterone, right, to prolactin, to cortisol, insulin, and one we miss, hypothyroidism, right? So it again, it affects the it increases the prolactin level. So it affects the gland. So these hormones, we have to understand their relations, and we have to understand their interaction with each other. So whenever we are going to treat the patient of fibroadenoma or fibrocystic adenoma, right, then we should be very, very careful that how we can create this balance between the estrogen and progesterone, right? And the mostly the estrogen, the balance between the estrogen and progesterone is not affected in the early ages, like after puberty. So you can say that after the age of 15 to 35, till then, basically there is a balance between estrogen and progesterone because due to the ovarian sufficiency. But after 35, the ovarian sufficiency is now it is going down, right? And the patient is coming with the ovarian insufficiency in which progesterone levels are going down, but estrogen is there. So whenever the progesterone level go down, the effect on the body is estrogen predominance, which lead to fibrocystic adenoma. And the difference is because now there is no progesterone to control estrogen now, in spite of in this condition, on the contrary to the fibroadenoma, in which the tissue is localized, right? In fibroadenoma, the swelling or the tumor or the nodule is localized, hard tumor which is localized into the one area, right? But in fibrocystic adenoma, the whole breast will be involved, right? Like all the tubules or the ducts are involved. So you will feel this slight smaller nodular structure under the skin in fibrocystic adenoma, along with that the fluid collection, which is absent in the fibroadenoma. So this is the clinical differentiation between the two. That fibroadenoma will have the single nodule or double or maybe more than one nodule, but they are isolated nodules which are hard, right? Not fixed and palpable. But on the other hand, in fibrocystic adenoma, there is a fluid-like structure and there is a small nodules along the ducts. So you can feel a nodular structure going through in this condition. The whole breast is involved. In fibroadenoma, the whole breast is not involved. And the age is also important. That is 15 to 35, and that is 35, and that is 15 to 35, and that is 25 to 45 for fibrocystic adenoma. So there is a difference between two.